There is a community of microorganisms that lives inside of your mouth. These can be different in health and in dental diseases. Before you begin this presentation, go ahead and pause to scan this code and try a short quiz on oral microbes. We'll start with talking about what healthy oral microbiota means. What is the oral microbiome? The mouth is home to over 700 known species of bacteria. These are present in numbers that are unique to the individual, and an imbalance in these numbers can cause disease. Habitats for the microbes in your mouth include the tongue, the inside of your cheeks, the palates, your teeth, and especially the gums. These organisms can survive and thrive inside of the mouth and contribute to your daily digestive activities, as well as your immune response. So what makes your mouth such a good place for these organisms to thrive? The mouth has a neutral pH and maintains a constant temperature between 35 and 37 degrees Celsius. This allows a wide range of bacteria to live. There's also areas in your mouth where oxygen is readily available, and other areas where organisms that don't want oxygen can live. Nutrients in the mouth exist in the form of either endogenous nutrients, such as amino acids and glycoproteins from the saliva, or exogenous nutrients, such as fermentable carbohydrates from the food we consume. A healthy oral microbiota can mean different compositions of microorganisms for different people. However, when plaque and tartar grows on the oral surfaces, it can lead to some of these bacteria becoming pathogens or inviting other pathogenic organisms into the oral cavity. If you've ever visited your dental care providers, you've heard of plaque and tartar that may cover your teeth and gums. But what is plaque? It's that sticky yellow layer of food and debris that collects on the tooth after you eat. It can be caused by several factors. Sugary foods and fermentable carbohydrates are the biggest contributors of plaque. Or if you're not practicing consistent oral care such as toothbrushing and flossing, that can also lead to plaque calcifying and becoming tartar. Other factors include your host immune response, as well as medications that can cause dry mouth or excessive smoking and drinking. But the biggest contributor of plaque formation are microbes. Plaque formation occurs in a few stages. The first stage is when a glycoprotein film called a pellicle attaches itself to the surface of the tooth. This can happen within minutes after brushing your teeth. In the second stage, called adhesion, a few primary colonizers, mostly aerobic bacteria that requires oxygen to survive, attach to the pellicle. These include the Streptococcus species, which we'll talk about later. In the third stage of maturation, the early colonizers produce extracellular polymeric substances called EPS that allow other more motile and virulent bacteria to attach by coadhesion. This process is called microbial succession. In the last stage of dispersion, the biofilm has been matured and is ready to be dispersed to other areas of the mouth, spreading it. Plaque biofilm is the primary etiological agent of dental diseases. The two most common dental diseases are cavities and periodontal disease. The species of bacteria involved in cavities is called Streptococcus mutans. Tooth decay, or cavities, occur when this species feeds on sugars and fermentable carbohydrates on the tooth surface and produce a byproduct of lactic acid. The lowered pH creates a demineralized lesion in the enamel called a cavity. S. mutans is a spherical-shaped bacterium which can survive with or without oxygen, which means it is a facultative anaerobe. It is also gram-positive and among the early colonizers in dental plaque biofilm. The Streptococcus species already exists in the mouth. It causes tooth decay when its numbers rise and there is an imbalance in the microbiota. The second most common dental disease is periodontal disease. When plaque hardens to tartar, it becomes harmful to the tissue surrounding it. The gums become red and inflamed and often start to recede if the calcified tartar is not removed by scaling by a dental professional. This is the first stage of the disease called gingivitis. If left untreated, it progresses to periodontal disease, characterized by a loss of bone in the supporting structure of the teeth. This disease causes irreversible damage. One of the first etiological agents of this disease is called Porphyromonas gingivalis. P. gingivalis is a rod-shaped bacterium that lives in the pockets underneath the gums, where it can survive in the absence of oxygen. It is one of the late colonizers of dental plaque biofilm and is considered much more motile than the Streptococcus species. This bacteria invites other microorganisms involved in periodontal disease to colonize in the mouth. Now that we've talked about how an imbalanced microbiota can cause dental diseases, how can we prevent this from happening? Some ways include limiting the frequency of sugar consumption. If you're going to drink a can of sugary pop or a glass of orange juice, try to drink it in one go so that the acid is washed out of the mouth with saliva rather than sipping on it throughout the day and providing S. mutans a constant nutrient source. Proper oral care and visiting your dentist and dental hygienist for scaling regularly are also important for preventing dental disease. Fluoridated toothpastes and mouthwash acts as a protective remineralizing agent for the enamel to protect against cavities. Lastly, educating yourself about how microbes cause dental disease is one of the first steps in preventing them, which you've already done today. Now that you're done watching this presentation, go ahead and test your new knowledge on the oral microbiota using the same quiz link from earlier.